As we grow older and our parents and grandparents grow older as well, it's really smart to think about long-term care. So what if your loved one needs long-term in-home health care, or maybe in-hospital care, or even nursing home care? How can you plan to pay for it? Joining us now is an elder care law expert, Robert Slutsky of Robert Slutsky Associates. Rob, it's great to have you with us. Many questions come up when we look at our elderly family members and we say we really want to be able to be there to help them or to help them help themselves. Let's start with insurance. Do we need insurance to cover long-term care?
Well, it depends on your perspective and your pocketbook. Medicare is not going to pay for any sort of long-term care. They might pay for medical health care, as you mentioned, hospital insurance, but they're not going to pay for the type of care that you're talking about. They're not going to pay for in-home care. They're not going to pay for nursing care that isn't related to an injury or an illness. So we can't look at Medicare to pay for those expenses. For some people who have the finances and have the resources, they can insure against the cost of long-term care. There's basically two options there. The first one is actually purchasing a policy called a long-term care insurance policy, and that's intended to pay for home care, assisted living, adult daycare, and nursing homes. And you can get all kinds of different types of policies, and they have all types of different costs.
How do we protect our assets, though? Because we don't want to have to spend everything that we have.
Well, the one is if you have that insurance, that's there to protect your assets because it pays for the care. The second way that people can do it is if they have the timeline, if they're still reasonably young and healthy and they can plan ahead at least 5 years, we can do some type, what's called long-term care or asset protection planning, and that might involve trusts, putting assets in trust, transferring assets to people you trust, and a whole bunch of different options to structure your assets in a way where you can access Medicaid, which is a public benefit, earlier rather than later. Typically, Medicaid is available for people who no longer have assets, and what you can do is there's ways to structure your assets so you can access Medicaid funding sooner rather than later.
And so what happens, though, if something all of a sudden comes up and it's an emergency? Maybe a family member has had a stroke and they really need care.
Okay, and if they haven't planned ahead, and some people have, then we do what's called crisis planning. And crisis planning is exactly that, where we reallocate assets and we look at the situation and we figure out if they can afford care, we'll pay for it this way, and then we can restructure assets at that point to try to access Medicaid sooner. And if they can't, oftentimes people of very modest resources, they'll get Medicaid pretty quickly without a whole lot of planning ahead. And that's kind of the third category of people. There's people who buy insurance, people who plan with or without insurance, and then there's the people who have modest resources, not a lot of money, and those people are going to get Medicaid anyway, and that's when we deal with crisis planning.
And so what everybody needs to know is that they don't have to do this journey all by themselves because you're there to be able to help.
My pleasure.
Yeah, really nice to see you again. Thank you so much. For more on planning for long-term care and Robert M. Slutsky's Associates, you can go to cbsphilly.com and click on the Talk Philly. We're coming right back.